Many of you may have heard of the ALS Ice Bucket Challenge, made popular back in 2014. Celebrities and everyday people alike would pour ice water over their heads in order to promote awareness for ALS and encourage people to donate to research. But how much do you actually know about this disease? For many people, this was just a fun new trend to try online with their friends, but for me and my family, it was much more than that. My grandmother was diagnosed with ALS when I was 9 years old, back in 2011. I witnessed firsthand the bravery and strength it takes to take on this disease. So today I hope to share with you some information about the disease that turned my entire family upside down, and hopefully give you some insight on what it's like living with ALS, having your body deteriorate right in front of you and not being able to do anything about it. So what is ALS? ALS stands for amyotrophic lateral sclerosis. It's also known as Lou Gehrig's disease, named after the famous New York Yankees baseball player Henry Louis Gehrig, who was diagnosed with this disease. This is a progressive nervous system disease in which the nerve cells in the brain and the spinal cord start to deteriorate, and as a result, causing loss of muscle control. It's a very rare and a very deadly disease. According to the Hospital for Special Surgeries, based on a U.S. population study, 5,600 people get diagnosed with ALS every year, which is approximately 15 new cases every day. The National Institute of Neurological Disorders and Stroke say about 10% of people with ALS live for 10 plus years, but the majority die within 3 to 5 years of diagnosis. So, what are the early symptoms that we can look out for ALS? Well, it starts out with difficulty walking, tripping and falling, leg and ankle weakness, hand weakness, as well as slurred speech and trouble swallowing. The symptoms are often very subtle, and because of this, they're usually overlooked or misdiagnosed. So how can you diagnose such subtle symptoms? Well, it's very hard, especially since it depends from patient to patient, because the neurons decrease and deteriorate at a different rate depending on the person. There's no definitive way to diagnose ALS, but usually they use the past records of physicians who have seen the signs and symptoms in patients, and they compare it to the current patient in question. Another way is to do different tests to rule out mimicking diseases, including laboratory tests, which uses blood and urine samples, as well as muscle and imaging tests, which detect electrical activity of muscle fibers. So we talked about the early stages, but what about the later ones? Well, in this stage, the voluntary muscles become paralyzed in the body, so the patients are unable to move except maybe their fingers, toes, and eyeballs looking around the room. The patient cannot breathe on their own, and as a result has to use an assisted ventilation system, often through a tracheostomy, in which the trachea has an incision put in it and a tube is placed inside in order for a machine to help the patient breathe. The patient is no longer able to speak or eat or drink on their own through their mouth, so they have to use a feeding tube in order to get the nutrients needed in order to survive. So where could such a terrible disease come from? Unfortunately, that is unknown to scientists. The Mayo Clinic says that 5 to 10% can be traced through their genealogy. However, that leaves 90 to 95% completely random, with no associated risk factor or family descent. To make matters worse, there is no current cure for ALS. However, there are some treatments in order to control symptoms, to stop complications, and to make general life better for the patient. The U.S. Food and Drug Administration recommends Riuzol and edaravone in order to prolong the survival of the patient by a few months. It decreases the level of glutamate and reduces damage to motor neurons. Another good way is through physical therapy, which helps improve the cardiovascular system of the patient. So what have we talked about today? We learned what ALS is, the different stages, the diagnosing process, and the unknown cause, as well as the lack of a cure. I would like you to take away to be grateful for your health and time that you have on this earth. ALS can affect anyone regardless of the current health and fitness level that you have. So cherish every moment you have, because like so many other ALS patients, you never know when that can be taken away from you. Thank you.